The MD Anderson Proton Therapy Center is at the forefront of an exciting time in cancer treatment. We are the leader in clinical research and development of proton therapy and are also the only program that is part of the MD Anderson Cancer Center, which has ranked among the top cancer hospitals since 1990 by U.S. News & World Report. Proton therapy is an advanced type of radiation that allows us to target tumors with extreme precision while sparing nearby healthy tissues. As a result, patients may experience fewer side effects and improve quality of life during and after treatment. Research is an integral part of our program. Through our groundbreaking studies and clinical trials, we are developing new technologies to benefit more people with cancer. Our team's breakthroughs, like pencil beam technology and intensity modulated proton therapy, or IMPT, have allowed us to treat a variety of cancers, including brain, head and neck, prostate, lymphoma, lung, and childhood tumors. With our dedicated and passionate physics team, we have published more than 100 articles on the physics and outcomes of proton therapy, which have propelled the expansion of this type of radiation. While we have innovative technology at our fingertips, we believe it's our team's experience, knowledge, and compassion that make us true leaders in the fight to end cancer. I invite you to learn more about the MD Anderson Proton Therapy Center and see how our work is making cancer history.
Proton therapy is the most advanced form of radiation available. While standard radiation enters the body and delivers dosage to healthy tissues before and after the tumor site, proton therapy releases the peak of its energy directly into the tumor, reducing stray radiation. The process begins as protons are extracted from hydrogen gas through accelerated rotation around a magnetized ring called a synchrotron. The protons increase in speed and energy and can travel up to 2/3 the speed of light. Once the desired amount of energy is achieved, a magnetic field steers the protons into the patient room, called a gantry. The gantry can revolve 360 degrees, delivering the beam at any angle. The proton beam moves through custom-made devices called an aperture and a compensator, which mold it to the exact size and depth of the tumor. As protons enter the patient, they deliver powerful treatment to the tumor with no exit dose. This is a major advantage when treating vital organs such as the brain. Pioneered at MD Anderson, intensity modulated proton therapy delivers radiation with a detailed airbrushing technique, painting it on the tumor layer by layer. This provides a greater advantage in treating irregularly shaped or deep-seated tumors, or tumors near critical structures in the body.
At MD Anderson, physics plays an integral role in all aspects of the Proton Therapy Center, from further developing the technology, to calibrating the equipment, to working closely with physicians and treatment planners, to create the most effective, individualized treatment plans for our patients. Our physicists also partner with the radiation therapists to ensure that protons are delivered to each patient with pinpoint accuracy and utmost safety. A hallmark of our physics team is the emphasis we place on research and development. We are constantly improving our techniques and finding ways to deliver radiation to even the most complex tumors. In fact, the MD Anderson team is one of the few groups credentialed to participate in NCI-funded clinical trials for proton therapy. We're proud that the developments that we have made with intensity modulated proton therapy are paving the way for better cancer treatment for more patients around the world.
Thanks to the researchers, physicians, nurses, staff, advocates, donors, and volunteers who support the Proton Therapy Center, thousands of patients are back to enjoying their lives. Here are some of their stories. A year after surviving bladder cancer, Chuck Martinez was diagnosed with stage 3 lung cancer. When he heard that proton therapy could target his cancer while protecting nearby healthy organs like the esophagus, spine, and heart, it was a huge relief. Because of proton therapy, Chuck was able to maintain his weight and his quality of life during treatment, even adopting a healthier and more active lifestyle after treatment. Cancer-free since 2007, today, Chuck is a marathon runner.
I'm taking it one step at a time, but I'm not about to slow down.
When John Floyd learned that he had prostate cancer, everything changed. His active lifestyle was important to him. Through research, he learned that many of the side effects of standard radiation are rare with proton therapy. And to him and his wife, that meant proton therapy was the right choice.
Even during treatment, he went to work every day.
John has been cancer-free since 2012, and he and Cher continue to enjoy their time together at home, abroad, and on the water.
Life is not always smooth sailing, but you have to keep moving.
In 2007, Carol Monroe's local specialist discovered a tumor in her neck and referred her to MD Anderson. Carol didn't like the possible side effects of surgery. She searched for an alternative.
I wanted a treatment that wouldn't interrupt my life, and that's why I chose proton therapy.
Since her treatment in 2010, Carol has experienced minimal side effects and never had to stop doing what she loved.
MD Anderson gave me the gift of being able to spend more time with my family, and that's priceless.
Because of proton therapy, patients like Chuck, John, and Carol have been able to receive customized treatment without having to sacrifice the things that were important to them. Their diagnoses may have changed their lives, but the treatment they received allowed them to keep living the way they wanted.
Thank you for your interest in proton therapy. We are excited to be leading the charge to change the way the world fights cancer. We ask you to help spread the word about proton therapy so we can continue to pioneer new discoveries and create a new standard of care worldwide. At the MD Anderson Proton Therapy Center, our goal is to end cancer. And with your help, we can do it.